We have hit flu season, and unlike last year where the COVID-19 pandemic had many of us still wearing masks, doctors are concerned this flu season has the potential to be extra dangerous. Dr. John Goldman with UPMC is keeping your family first with more on what to expect this flu season. Dr. Goldman, thank you so much for joining us here on Fox 43. I want to start here. Why is flu season expected to be so much worse this year than previous years?
So a couple of reasons. First of all, obviously, we last year social distanced. There was basically no flu. There was less flu at the peak of the flu season than there usually is in the summer when we are considered to be out of flu season. As a result, most of us did not get the boost in immunity we get from the flu viruses circulating, from being exposed. And in fact, we're worried because of that, because of the lack of social distancing, because people are out of masks, that we're going to see flu come back with a bit of a vengeance. And in fact, we've already seen other respiratory viruses start to come back more frequently, start to come back earlier in the season. So the worry is precisely because we were so well social distanced last year that we really weren't exposed to the flu. We have a little less immunity. And as a result, the flu will come back with a vengeance this fall and winter.
And I know a lot of people just in general, they're wearing masks less and less because so many of us are vaccinated, but that doesn't necessarily, a COVID vaccine doesn't protect us from not getting the flu.
Yeah, the COVID vaccine does not protect against the flu. Only the flu shot protects against the flu. And we are in fact urging people to get their flu shots right about now.
So
At
how much more likely would it be then to get the flu this year?
Oh, it'd be much more likely to get the flu this year because last year was one of the least amounts of flu in probably 20 years. So it's much more likely we'll get the flu. And that's at the same time we still have COVID circulating in the Northeast. COVID often comes back in the fall with with colder weather. So we're worried that we could have a twindemic. We could have COVID increasing and we could have flu increasing. The best way to prevent both of those viruses is to get your shots. Get your COVID shot, get your flu shot.
And we know we've seen the statistics and what we're seeing right now with what COVID is doing to the healthcare industry in terms of hospital space, and it's running dry. What can an influx of the flu do to just stretch hospitals even more thin than they already are?
So normally, in a good year, a bad flu season will stress the hospital system. With COVID, with some of the staffing shortages we have, with healthcare workers the shortage of healthcare workers, a twindemic, having both COVID and the flu would really stretch our system. And it's very clear when we have enough space, when we have enough doctors, when we have enough nurses, we take really good care of you. The system, however, can get overwhelmed. When resources are stressed, when physicians are stressed, when nurses are stressed, you simply don't get quite the care you normally would. Again, best way to protect yourself is to get both a flu shot and a COVID shot.
And let's talk about the shot. What do you say to someone who says, you know what, I've never gotten the flu before. If it ain't broke, don't fix it. Something that, I have no reason to get. What do you say to someone that says that to you?
The best analogy was someone who's played Russian roulette and it's never hit the chamber. People get very sick from the flu. As you get older, you get sick from the flu. In fact, in high-risk patients, you are 50% less likely to die if you get your flu shot. So you're 50% less likely to die during flu season. When people say, I've never gotten sick before, that doesn't mean they aren't going to get very sick. And as you get older, as you get more medical problems, it becomes more likely that you will get sick. So just because you've dodged a bullet once or even several times doesn't mean you're going to continue to dodge that bullet. In addition, you have an obligation to keep your family safe. So when we look at elderly patients, one of the best ways to prevent the flu, prevent them from getting very sick, and prevent them from dying is to get their kids, and most importantly, their grandkids, vaccinated.
COVID
So
and the
when
flu,
you get the
COVID
Go
and the
ahead.
flu are pretty similar with symptoms, correct?
COVID and the flu are basically indistinguishable with symptoms, with the exception of COVID often causes a loss of the taste of the sense of taste and the sense of smell. So you can have COVID that looks like the flu and flu that looks like COVID. The only difference is the mortality with COVID is higher than the mortality than the flu, probably by about fivefold.
And do we know how efficient the flu vaccine is this year? We've heard so much in the past year about vaccine efficacy. Do we know how effective this year's flu shot is?
We don't typically know until we actually get experience with the vaccine. It varies from year to year, but typically they've been running about 50%. But just like with the COVID shot, the flu shot protects you from more severe disease. So even though if you get a breakthrough infection with the flu shot, you are much less likely to get very sick, hospitalized, or die, just like the COVID shot. So even though we say it's 50% efficacy, it prevents disease 50% of the time, that includes all disease. It's much more effective at preventing hospitalization and death. And again, high-risk patients, you decrease your risk of dying by 50% by getting a flu shot.
Protects you, protects others, flu, COVID. Dr. John Goldman from UPMC protecting you. Thank you so much for joining us on Family First with Fox 43.
Thank you very much for having me.